Great sunscreen is a must. Some of the pigment correcting, clinical grade skincare is a must.
We talked a little about loose skin. Is there really any technology that can actually tighten skin?
In terms of skincare, doing tretinoin or retin-A on those also helps for the same reason. That's the topical that's going to build collagen in the skin. That combination is likely a good idea.
They do tend to hurt. So you may want to have like longer lasting numbing medicine or possibly even mild sedation to get that treatment.
The beauty scientists, Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
Hello, this is Dr. Roy Kim, and I'm here with my business partner and beauty podcast partner, Dr. Kristy Hamilton. And today we'll be peppering her with questions because we're going to be talking about the new Mom Beauty Jumpstart. So, Kristy, congratulations on being a new mom.
Thank you.
And so I'm sure you've been asked by your patients, and I know I have occasionally asked my patients, okay, I'm a mom. What do I do to get back to the way I used to look like or even look better? In terms of your overall face, and we'll start way up here, what type of skincare do you recommend?
So as many of you know, there's a lot of ingredients that are just taken completely off the list, namely retin-A or tretinoin, these vitamin A derivatives. And then so many of these products and ingredients are just not tested in pregnant women. So we just say you can't have them because the risk does not outweigh the benefit. So by the end of the pregnancy, look, you end up with the most precious, beautiful gift you could ever imagine in the form of the baby. But I also remember being like, wow, who is that in the mirror? I don't recognize myself. And I am just ready to love on this little child and feel better about myself. So during my pregnancy, I had a very, very simple regimen and I was still able to use exosome products. So that was one of the things I could keep using that was actually powerful and potent. Afterwards, I very quickly resumed using tretinoin. You can use that while you're breastfeeding. Whatever tiny little amount may get into breast milk is marginal. And as I was talking to a patient the other day, their spinal cord is fully formed. So it's just not a concern. And then even other ingredients like hydroquinone. So if we're planning on doing lasers or we've got some spots or melasma that we're working on, I looked up those recommendations too. And basically they say, just don't put it on the nipple itself. So don't apply the product to your breast if you're breastfeeding, and then it's going to be okay. So I'm back completely on my normal pre-pregnancy skincare regimen. And I definitely recommend clinical grade skincare and going back on retin-A or a strong retinol if you aren't on it already.
Yes, as doctors, we're both mindful that yes, you're not pregnant, but you're still breastfeeding. So this is important in terms of any skincare ingredients you may use. Getting to the next topic would be, okay, neurotoxins, Botox, fillers. Are they safe and okay, as a new mom?
Yes, they are. So all the female physicians I know that did Botox pre-pregnancy, they resumed when they were breastfeeding. And again, any small, tiny amount that you inject into your face, it doesn't pass through the barrier. And even if some tiny microscopic amount did, it's okay. And it may be that it's even safe during pregnancy, but no one's done those studies and no one's willing to take on that liability. We'll see, now that they're using it for spastic bladders and some other conditions that are more medical, even migraines, we may find eventually that it is safe in pregnancy. But for me, I said no Botox while pregnant, but I resumed it 5 days after Caroline was born. I asked my mom, aka my office manager, to bring some home. That was a game changer. So that was back in there 5 days after. And then the other thing that I did was 2 weeks after I did fractionated CO2 laser, so an ablative laser, the strongest I've ever done. And that was great. I feel like after almost a year of not doing Botox and not doing my normal skincare, I just blasted away those brown spots that showed up, fine lines, wrinkles, and just resumed a beautiful glow to my skin. And that really helped just make me feel fresher and less like the tired new mom I was at that point.
Well, good to know that, yes, you look glowing as ever, but hey, if you haven't been able to do very much for about a year, you can do it pretty quickly. The final thing, the next question, about the skin and face, not the final question, because we have a lot more, is melasma, which a lot of our listeners and viewers know about, is something that can actually occur during pregnancy. So how do you treat melasma now that, you have a baby and you're breastfeeding?
So melasma, we call it the mask of pregnancy. So it's a hormonally driven hyperpigmentation of the skin. So we'll see patients that have it, maybe on the cheeks. It can be kind of in this butterfly pattern on the brow. Some patients get it on their upper lip, and they, unfondly refer to it as a mustache. So it's bothersome, especially for people who've never had pigment issues before. So great sunscreen is a must. Some of the pigment correcting clinical grade skincare is a must. We may use hydroquinone or some of the other prescription skincare in conjunction with Retin-A. And then you can choose to do some chemical peels, and that helps turn over the skin. So there's one I really love in my clinic called the Cosmelin mask, and it's specifically geared towards that. What I love about it, it's a very slow acting, but deeply penetrating mask that goes on, and it continues to peel for some days afterwards. So that's nice because it doesn't everything, since it's a little bit calmer application. So, and then if you are like me and very fair, then even some laser treatments can be helpful, but we just have to be very cautious with melasma. You don't cause it to re-flare up. And then passage of time. It takes a long time for the hormones to rebalance after having kids. I mean, depending on what you read, it can be anywhere from 6 months to even a year or two. Everything kind of stabilizes again. So just a little patience with yourself, but we're generally able to improve it, although it can kind of melasma, oftentimes we're treating it and then it kind of comes back and then we're treating it again. So we don't have a cure for it, but we definitely can treat it.
Gotcha. And so it's great that you can sort of start something for melasma immediately, which is also good to sort of try to treat it sooner rather than later.
Yeah.
Now, in terms of generically, yes, you're going to gain weight. In fact, the American College of OBGYN say the average weight gain with pregnancy is 25 pounds, and that can vary. If you want to lose weight, do you have any general recommendations? And then we'll get into some specifics for weight loss.
Yeah, so it's slow, steady, and sustained. You don't want to be, especially if you're trying to breastfeed, you don't want to do something extremely calorically restrictive because you still need to produce for the baby. And even if you're not breastfeeding, and that's fine too, slow, steady weight loss is less likely to yield really, really loose, saggy skin. It gives your body time to contract. So I recommend a high protein diet. So we're talking, it varies a little bit on your size, but at least 100 grams a day, which can be hard to do, helps keep you full and your body is in healing mode. It's like I treated myself the same way I treat my surgical patients. It's like your body has to recover from this I say trauma in the physical sense, not the emotional sense. And I wore a compression garment. So just like after liposuction, I did a phase 1 and phase 2 South American style compression, which is very common in Central and South America, not as common in the United States. And that kind of helped remold things and I think help bring my abs back together because they were separated, I felt, right afterwards, and they went back together. So I'm sure genetics helped, but I also think the compression garment did. And then I also did lymphatic massage because I did not gain the recommended 25 pounds. I gained the not recommended 55 pounds. And a lot of that was water weight. And afterwards, my ankles and my lower legs, they looked like tree trunks. I'd never seen anything like that on myself. And so I could hardly bend my ankles. So that was really instrumental in kind of shedding the water weight. And then the diet and, just walking at the beginning, nothing crazy in terms of lifting anything heavy. And that just kind of slowly but surely got me metabolically back on.
Yes. So, well, the next thing is, of course, we talked a little about loose skin. Is there really any technology that can actually tighten skin?
So Kim Kardashian popularized the radiofrequency microneedling for the abdominal skin. She posted that on social media, and that kind of opened up this whole onslaught of RF microneedling. And I think, we've all seen some pretty spectacular before and afters. There's also a lot of failures, I think, in that category. So some people seem to respond really nicely to it. Others don't. It's hard to know, even with the same or similar treatment modalities. So I think overall, people are generally underwhelmed by how much non-surgical devices can tighten skin, but they can be worth a try. And it's definitely better than nothing, but certainly nothing like a tummy tuck or something like a true excisional procedure where we're removing tissue. So it just depends. If you've got a little bit of loose skin, then these devices can be reasonable, especially if you've got some extra resources to devote to that. But if you're expecting something transformative or you have a lot of stretch marks, then I think you'd find more value in surgery.
Yeah. And so what you're talking about, just for the viewers and listeners out there, microneedling, yes, we're making a tiny needle hole. RF is radio frequency. So while the needles are actually in your skin, we can actually run radio frequency energy through those needles, and that really heats up the area. The heat, the neovascularization / neocollagenesis / magic will tighten skin. However, some people think it's more that, hey, we're inducing scar tissue or inflammation. We're not really tightening skin. Other people would argue we're actually tightening skin. I think a lot of people would say we're tightening skin, but not that much. But it just depends on your skin and your results. And for the viewers and listeners out there, RF microneedling, I mean, there are like more than 15 devices now in the US. They're all called different brand names. The ones that are more aggressive with, I think, a deeper penetration, a little more energy, they do tend to hurt. So you may want to have like longer lasting numbing medicine or possibly even mild sedation to get that treatment.
Yeah, and which of course, especially in the United States, all that drives up the cost significantly. So then you're looking at something, and it may be by the end of that you're getting closer to a surgical cost for some of this. So because it takes a long time as well.
Yes, it does.
If you're stamping, if you're trying to stamp your entire torso and do multiple passes, it does take a long time with these devices. So it's not necessarily a quick sedation or a quick general anesthetic either. But I think for skin quality, yes, I think that helps. I think it helps quite a bit. But tightening, I think we're still waiting for the miracle device to come by. And when we find it, I will buy it.
So the other question is there really any skincare product, any lotion that will help eliminate or reduce stretch marks? And that also includes technology. Does laser reduce stretch marks?
So we know gold standard for stretch marks, if skin tone appropriate, is fractionated CO2 laser. So that kind of similar to what we were talking about with radiofrequency microneedling, which is another option, is going to heat the dermis, which has been shredded or torn apart, and help build collagen in it. So that's nice because the stretch marks are depression, the true stretch marks, and that can help thicken them. So at least you're not seeing as much of the textural changes. And it's going to cinch it up conservatively. These are always a series of treatments. No one's doing one round of CO2 laser and seeing the ultimate end game improvement, but you can really help with that. In terms of skincare, doing tretinoin or retin-A on those also helps for the same reason. That's the topical that's going to build collagen in the skin. That combination is likely a good idea. And then once a series of treatments using that has been done, and retin-A for some time, then another great modality to add on is dermal tattooing. So medical grade tattooing, where we actually match skin tone, because especially people with more melanin in their skin, it's not just that the stretch marks are there, but they're so much lighter than the surrounding skin that they really, really stand out. So if you can tattoo those to match the surrounding skin tone, they're still present, of course, but much less noticeable. And that can make patients feel better.
Those are all great options. And again, the series of treatments of the fractionated CO2 laser, again, slightly more painful / it's going to take a couple sessions / it drives up the cost. So that's something that, patients should realize. Yeah. And then one of the last questions I have was, what do we do about sagging in the gluteal region? Or specifically, you have a slightly saggy butt. What do you do about that?
Yes, the buttock. So, any of these things that cause expansion, deflation, that we kind of skip the breasts because that's almost like its own mommy makeover topic. But any of these areas that are expanding and deflating, you're going to get some excess tissue. And so for the buttock, a nice option is some of the biostimulatory injections. So the calcium hydroxyapatite versus the polylactic acid. So that's a nice way to kind of like plump up and give a more toned look to the buttock. Of course, you should also be doing your squats and deadlifts and working out in the gym to try to build some muscle, because that similarly will kind of plump everything back up. But I love those injections in that area. It's like nice for skin quality and can build some conservative, like sculpting level volume, help smooth cellulite.
So those are all great things to know. And of course, yes, certainly for the body, it definitely seems that exercise, overall, change in metabolism and dealing with it, diet, all those things have a huge foundational impact. I mean, if that's good enough, great. If it's not quite where you want to be, at least you're starting with a good foundation and be able to heal faster.
Yeah. And I think, finally, every woman is going to attack this at her own pace. Be patient with yourself. These things don't happen overnight. Some people swell more, some people swell less, some people gain more weight, some people less weight. When your hormones are all over the place, some women may find that the weight just falls off. Others, it just takes a lot more effort. So just be kind to yourself. You created a little life. It's amazing, and be patient with the process. And as much of these things as you can do while you're caring for a very, very needy, brand new little baby. Maybe you're not exercising as much as you want or not eating quite as well as you want, just like baby steps, like literally baby steps every day. And and finally for the weight loss, I think in your back pocket, and I wouldn't do it while you're breastfeeding for the same reason we were saying before, not necessarily because of the medication, but because of calorie restricting. Semaglutide's also an option when you're done with all of that. If, you've got a final little extra weight, that can be helpful. So I know a lot of my patients say they still got that extra like 10 pounds that they just can't kick, and a month or two on that medication can help get them back to where they were.
Yeah, no, I'm glad you brought that up, because yes, while you're breastfeeding, you want the nutrients, you want the metabolism for your own body to be able to generate the breast milk for your baby. So if you're on those mandatory weight loss drugs, where the drugs will make you lose weight no matter what, may not be the best while you're still actively breastfeeding.
Yeah, I agree.
Yeah. Well, thanks so much for sharing all these great hints and strategies for new moms. And as always, thanks so much for joining us here on The Beauty Scientist. And if you have any questions, comments about this, if there's some certain medications, treatments, whatever that you think would be great for new moms, let us know. And as always, stay beautiful.
Stay beautiful.
Thank you for joining us on The Beauty Scientist. Be sure to visit thebeautyscientist.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.